How do I know treatment is working?
The easiest way to see whether or not treatment for myelodysplastic syndromes is working is to look at the blood counts. If a person starts out with anemia and all of a sudden the hemoglobin rises from 8 to 9 to 10 to 11 to 12, you know the treatment is probably working, and a person will feel that. Some of my patients will reflect back to me that they feel normal for the first time in months or even a year as their hemoglobin starts to rise. That actually happened just a couple days with a patient of mine in clinic. Another way we check to see if a treatment is working is by checking another bone marrow biopsy, particularly patients who have too many blasts in their bone marrow to start with. It's normal to have less than 5% blasts. Some people with myelodysplastic syndromes may have 5, 10, 15% blasts in the bone marrow. If we check another bone marrow after treatment and that blast percentage shrinks to less than 5%, we know that a treatment is working as well.
How do I become more knowledgeable about MDS?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
So MDS, as opposed to AML, the treatment can take a little while longer to work. So now specifically talking about azacitidine, another thing that we commonly see is the treatment is not tried long enough. So it can take up to 4 cycles of treatment. These are monthly cycles, so it's given for typically 7 days. After that, it takes another 21 days. So if you go for around 28 days or a month for the complete treatment to finish. So it would be 4 months of those before we might expect to see a response. So there's even evidence that some patients respond after that, so up to 6 cycles. So I think what we see, I quoted that 60% response rate from the clinical trials, but in actual practice, we see a little bit lower responses, and that may be from the cases where it's stopped too early, and if the treatment had been continued for at least 4 cycles, but if able to get to 6, just to exclude that there's going to be any response, I think we would see more similar to the clinical trials of a 60% response rate. So yeah, it does take a little while longer. This azacitidine, it's an epigenetic drug, and so we know with epigenetic drugs they can take a while longer to actually show the response. So we talked a little bit about genetics. These are mutations seen in the DNA of the leukemia cells. Epigenetics literally means above the DNA. So these are not changes to the DNA, they're marks on the DNA, we call it methylation, or on the organization of the DNA, the chromatin. If there's changes in those can impact the DNA expression. So when I say epigenetic, it means something that's targeting those mechanisms, not directly the mutations themselves.